September, all month, has been National Prostate Cancer Awareness Month. According to the American Cancer Society, prostate cancer is the most common type among men in the U.S. other than skin cancer. We've got Dr. B here in the studio with us. Thank you for joining us once again this morning.
Good morning, bud. How are you doing, man?
I'm well. Let's talk about this. So what is the process and why are we talking about getting screened for prostate cancer?
Well, prostate cancer is one of the most common cancers in men, and over 175,000 men will get diagnosed with this cancer. The thing is that even if you have it, and if you get screened early, your survival is like pretty good.
Okay.
But most guys are just worried because all they think about prostate cancer and screening is the exam and the finger. But the reality is it all starts off with a simple blood test, a PSA test that we can use as kind of like a starting point to see where we need to go in terms of the screening process.
Is there something, we've all heard at this point, you know, you got to get checked, you got to get in. Is there a time frame now? It used to be right around 50. Has that changed a bit in recent years?
So there's different guidelines, but I like to keep it simple. If you're 50 or above, go start getting screened at least once a year.
Okay.
If you have a family history, then start having a conversation with your doctor at about the age of 40. Just this week alone, I diagnosed a 43-year-old guy with 3 young kids with really aggressive prostate cancer. So even that was like shocking for me. I'm like, man, like 43 years old. So stuff I actually say, I'm actually starting to see in the office.
Right, so something that we all need to be aware of here. Is there anything, are there symptoms, things that we should be looking out for? If we haven't already gotten a screening and already have a diagnosis that says, yes, we've caught it early and you have it, is there anything else that we may be feeling that may clue us in that we do have prostate cancer?
The thing with early prostate cancer is you probably won't feel anything.
Okay.
But if you do have symptoms, because the prostate lives between your bladder and up over your rectum, usually you start having trouble peeing. But the confusion happens because you can start having trouble peeing because your prostate is just growing because you're getting older.
Sure.
But if it is truly cancer, you can have trouble peeing, you can have pain down here in this area, you can have pain in your bones. There's a whole plethora of symptoms, but I don't want to delve into it too much because it may scare the guys away.
Right, no, we're not trying to scare. Yeah, it's just something, of course, this is Awareness Month. We're trying to educate people on this. Is there anything that we can be doing right now to set ourselves up better for prostate health? Is there anything in exercise or diet?
The first thing is, during the next commercial break, call your doctor and go get yourself screened, especially if you're above the age of 40, start the conversation. The second thing is, if you look at all the stuff that prevents things like enlarged prostate or prostate cancer, it's the simple stuff like just live a healthy lifestyle. If your weight is in good control, if you eat a healthy, balanced diet, if you exercise on a regular schedule, tons of research shows that that is going to help prevent not just this cancer, but many other cancers in your body.
All right, some of the simple things. Dr. B, we appreciate it. Of course, September here, National Prostate Cancer Awareness Month. Things to just remember. If you haven't already, and you're already reaching 40, I'm almost there. So I'm about to make this call as well to the
doc. We'll do it live.
We'll do it live.
We'll do it live on air when you turn 40.
We're definitely not going to do that. Stay with us. We'll be right back.